Specialist surgeons will be conducting surgeries at the Mankweng Hospital in Limpopo to celebrate Women's Day. This is part of the department's campaign to get rid of surgical backlogs in the province. The program started at the beginning of August with several surgeries conducted at various hospitals in the province. For more on this, we're joined now by SABC News senior reporter Pimani Baloyi and video journalist Lula Custance. A very good morning to you, Pimani. What's happening where you are?
Good morning, Desiree. Yes, as you were explaining, Desiree, we're inside one of the theatre rooms of the Mankweng Academic Hospital just outside Polokwane. Just as you were explaining, Desiree, a group of specialist surgeons, most of them who are female, have decided that throughout the month of August, they will be going to various hospitals in the province and trying to get rid of the surgical backlogs that is in the province. Right now, as you can see behind me, Desiree, there's a pediatric surgery that is currently happening, and these are some of the specialist surgeons that are conducting it. And Desiree, to speak more about this specific program, we're joined by Health MEC in the province, Dr. Popira Matuba. MEC, before we speak about this program, let's talk about this specific procedure that is happening behind us. What is the purpose of this, and tell us what is happening specifically?
I think what we are currently doing, as you have indicated in the beginning, is that our female surgeons, this time around with this particular case, it's Dr. Batka, who is our pediatric surgeon, leading the team of different specialists, also especially on the pediatric surgeon cases to operate. For instance, now they are busy with a 12-month-old baby with a hernia, and they are busy at repairing that particular hernia. And there will be many other cases. I think they've got more than 10 cases of different types of some inguinal hernia repairs, some umbilical, some undescended testes. There's got quite a lot of cases that were affecting the mothers, and the mothers have been having serious problems with that. Now today, we felt that it's important that when the whole country is honoring women, so as women who are in medicine, women who are in the health sciences, we need to honor Charlotte Mankweng, who is the first woman to graduate, black woman to graduate with a science degree. We believe that she has paved the way for us. You see us today being able to study in those science degrees, in medicine, in any other type of a science degree, because she has paved the way for us. And the only way we can celebrate her is to showcase the skills that we have learned because of her, that we can impact positively in the lives, especially of the rural and poor black people.
And MEC, the program started at the beginning of the month. Just take us through some of the achievements achieved thus far.
Yes, we are really proud of our female surgeons. We started, I think on the 5th, if I remember, just in one day, Dr. Jonas, together with the very same Dr. Batka, Jonas is a general surgeon, and also the ENT surgeon, Dr. Kos, they have been able to operate more than 19 patients just in one day in Pimani Hospital, another rural hospital. And we've been continuing again on the 6th. Even today, we're still continuing. Tomorrow we'll be in Chilizini. The ENT surgeons will continuously. The maxillofacial specialists will also be continuing. We've got so many women with tumors, so many women with goiters, so many women with uterine problems, which they don't know where to go. Now we are saying, as Mom Charlotte has said, you can't be up there on your own. You must be able to say, as you rise, carry another woman. So for instance, now we are carrying these women who are mothers of these innocent babies, mothers who have not been sleeping because of the conditions affecting their children. So we will continue. Our target is to make sure that in honor of that 150 years that Ma'am Charlotte would have been, we would be able to operate more than 150 cases. And the beneficiary must be rural. If you are rural and you are poor, you must be able to benefit from this program.
And speaking of that, MEC, a rural woman sitting in her home right now watching us, how does she benefit, and which other hospitals will you be going to as the month progresses?
Yes, we started in Waterberg. We are going to Wembe Chiridzini Hospital. We'll be going to Mupani Letaba Hospital. We'll also be going to Skukune Philadelphia Hospital, where we have got the only female orthopedic surgeon in the province, Dr. Boshoman. She'll also be operating the women and patients who are poor and rural in that side. We will continue. So what I always advise is to say to our people, when you have got your condition, go to your nearest hospital so that the doctor can be able to examine you, book you. If indeed, like these patients that we are operating today, they've been booked in different hospitals. Some of them, their queue was they will come next year. Some of them would be operated in December. Because, you know, when we were dealing with the third wave currently, we had to stop some of these procedures because all our doctors had to focus on that. So it won't only end with August month. This month is just to say it's women who want to solve their own problems. We don't want to spend the day you calling us Malibongwe Igamalama Koskas only. We want to show you that we deserve to be praised because of the work that we can do. We can also impact positively in the lives of our fellow women. So that is what we want to show this particular month. So to all our people out there, go to your nearest hospital. In the next month, when we come with the Rural Health Matters project, we'll be bringing our male counterparts. But we realize that if we do it together with the men for this particular month, you will continue to treat us as kitchen girls. Today we just want to show you that Dr. Batka, Dr. Mtibi, and Dr. Oliphant, who are here, female, very young, they can show you that their skills with a knife, it's not only good in the kitchen as the public thinks so, it's very good and very much more better here in the theater, saving the lives.
Thank you so much, MEC, and happy Women's Day to you. That is how Dr. Ramatuba and other specialist surgeons in the province are spending their Women's Day. Desiree.
Thank you so much, and we'll continue to follow what happens thereafter. But onto the